Okay, so you are the formulator of this beautiful product, Vitality, in which I know we're getting lots of comments on the bottle too. It is a very sharp bottle.
It's a good looking product.
So Vitality men's hormone support. Okay. First, I'm going to tell you these amazing prices because if you're a member, which most of you, you know, if you've been with Live Good, you're members because you know you save money by buying more than one product a month. And again, we're talking about the multivitamin, the vitamin D, the magnesium, the factor 4, all the stuff. So $19.95 for members. And if you're not a member, retail, it's still extremely affordable, $24.94. This is for a 30-day supply. And I know Dr. Ryan did a little test before formulating on himself, so did some pre-blood work, some midway, and just did another round of blood work. We don't have results back yet. But so far, I mean, you can talk about it.
I will.
Your improvement. So
yeah, I will.
Tell us all about Vitality.
Yeah, we'll do. Absolutely love the product.
What you chose.
For sure. And if you guys take a look at this, and you're not going to find another product on the market that uses all standardized extracts. Go back to the women's hormonal support product, same thing.
What is that?
Standardized extracts. So for instance, one that's probably very relatable to people is Tongkat Ali, or we have 2% uricamone. So if you look at the label, it's standardized at 2% of the actual constituent, the bioactive constituent of that herb or plant.
Okay.
You know, these are natural products, you know, and most of these herbs are. So you have to make sure that when you're messing around in the herbal supplement world, that when it's possible to choose a standardized extract, you should, because that's, again, like I just said, that's what you're trying to get. You're trying to get the active component, the constituent out of the plant. So really important. It does drive up cost, but the quality is there. So awesome that we were able to do that. Now, a lot of the ingredients here, guys, we're looking at it from a couple of different perspectives. We're looking at it from men's health. So what does that mean? To me, it means testosterone. Obviously, I think that's a big part of this, right? Now, testosterone has total testosterone and free testosterone. Total testosterone has is a very, very good and accurate measurement of total testosterone in your body. Free testosterone is an estimate, but it's the more important one because it's the stuff that's circulating, not bound to a protein, is circulating in your blood, active, bioavailable testosterone. That's the stuff that we really want to focus on. So you will notice that some of these ingredients in here, some will kind of play on the entire hormonal panel. Some will increase just maybe total testosterone, but then like something like a boron increases your free testosterone, right?
Okay.
And that's kind of the stuff that I've noticed when I'll talk about some of my blood work here too. So we've also looked at DHT. So when you're talking about prostate health, so big part of this for me was helping men that deal with prostate issues. It's extremely common. Just so you all know out there, I don't believe that testosterone replacement therapy directly causes prostate cancer. That was something that somehow got brought out. It seems to be completely debunked. So the risk isn't there. They're actually showing for people that had prostatectomies or had prostate cancer at some time, when their libido crashes, they add back in testosterone replacement therapy in low doses, controlled and well measured. So they monitor them frequently, and they're just fine. So for the men out there that,
while you're on that topic, I don't know if you saw that.
I did see prostate. Yeah, he had prostate removed. Right.
It's still beneficial.
Well, again, that would definitely be with your urologist, right? So you definitely need to be talking to a provider. If you're not getting good, clean answers, maybe get a second opinion on that. But yeah, we're seeing. You can take that out actually. You're seeing a lot of younger docs that are coming to the market. Right, they're practicing a little different, and it seems to be men are getting great results.
Okay.
So for those people that are the testosterone levels, I'm sorry.
No, well, the one you took away was talking
levels,
about the
tests.
What test? Which
I'm going to hit on that, but like test levels vary widely, very, very, very widely. You can be considered low under 300. Some functional medicine doctors would say low under 500. A lot of it's not just your hormone panel, even that's something that you need to have done. So to answer your question, Pinky, right now, hormone panel, just go get a men's hormone panel. I don't know exactly what the provider is going to order. They should have at least all of the sex hormones. They should have your cortisol. They should have thyroid. So
free.
And yeah, of course, your free testosterone. I feel
like that's a common one that's not.
Yeah, you know what? Make sure you get your free testosterone on there. It's an estimate test, but yeah. Other than that, you just ask for a hormone panel. We do have a suggested panel. If you email us, we can send to you. But here's the thing about hormones, guys, is it's not just about the blood levels. It's subjective. How do you feel? So there should be a full questionnaire about signs, symptoms. How are you feeling? Are you exhibiting any signs? How is your libido? How is it? How are all the things that we talked about? How is your energy levels, your stress, your anxiety, the stuff that men don't really address. It needs to be brought up and needs to be talked about. Use me as an example. My testosterone levels, total testosterone, has been low my whole life. And that's another thing. It'd be nice to have hormone markers when you're 18, 25, 30, 35, 40. It'd be great to have that. So you know where your peaks, you know where your optimal levels were when you were, younger and producing more testosterone. But it's okay if you don't have all that, but you should still base it on your symptoms. So how do you feel? So like my testosterone levels are kind of low. They've always been that way, but I don't exhibit any of the signs or symptoms. I don't have any complaints in those categories. So therefore, I don't need to go on testosterone replacement therapy, TRT. And when you do start TRT, again, another conversation, not today, that can be a lifelong endeavor. That's typically something that potentially gets into the category of irreversible. Kind of need to stay on, but managed well, it can be. But then you're definitely wanting to make sure that you're blocking some of the estrogen conversion. You definitely want to have all your stuff dialed in with a good doctor. That is a prescription. That is a whole different course other than what we're talking about today. So, that's something to think about. So my testosterone, well, when we were formulating this product, I said, let's hit the testosterone category. Let's hit the prostate category. Let's hit men's health. Let's make sure we're covering estrogen. Let's make sure we're covering some of the side effects of having a lot of estrogen circulating and picking up some of these side effects. And the lifestyle components. How are we helping people take something that the body needs so that it can start operating at a bit more of an efficient, optimal level? So that's why you'll notice some of these ingredients when we go through them are there. And I mentioned boron, but you'll also you'll see DIM in there. We have DIM in there in the women's because it helps to improve the metabolism of estrogen. There are multiple estrogens. There's 3 primary estrogens, but estradiol, like you want to maintain a proper metabolism of estrogen. So you'll notice that's in there as well. But free testosterone with the boron was a big thing, right? So when I did my test, this is what I did. I had the formula. I had the samples all in my house. It was June. I took a blood test. Then I started taking a supplement. I got tested again in September. And then I just got tested again last week. That's about 3 months apart each one. Right.
I was going to point that out because you guys have to understand. You got to
give it some time. Give it some time. So my total testosterone went up 20%. I went from like 370 to 420, something around that kind of somewhere around there. That's a big change. It was a big jump. 20% is huge. That's statistically significant. It's a big jump. And don't forget, guys, I'm N of 1, right? Like it's me. It's just me. You guys will have different expectations, different results. Everybody will. There's so many different variables and factors that go into all of this.
Also, your lifestyle. My
lifestyle, right? And I really do I've been trying to focus on this more and more. So, and then my free testosterone, though, went up 60%. So it went from like 60 something to a little over 100, right? So it's a huge freaking jump. Huge jump. And so that's the stuff that I was telling you. That should be like a goal for you guys to know your numbers and work towards improving those numbers because it's never too late. It's never too late. And if you got to go down the path of TRT and you got to go down with the prescription therapy, that's an option too. So just keep that in the back of your mind. And it can have a lot of benefits, guys. Like people like brain fog is one of the biggest things. There was a carpenter friend of mine that's a little bit older, 60s. And he was suffering from anxiety, depression, brain fog. Like seriously, couldn't even get his thoughts right. Extremely skilled carpenter.
I'm glad you mentioned brain fog.
Brain fog is such an important one on the TRT, on the test side of things, because it really interferes with cognition, having low T levels. And then again, that nasty, what do you call it, cycle, but that nasty cycle, the vicious cycle you get stuck in, man, it only goes down and down and down. And men just chalk it up to this. Well, that's part of Asian. That's what I am. That's what it is.
Or men think, like you said, men don't go running for help because is it a macho thing?
It could be, of course, macho and ego, for sure. Yeah, I think there's a lot of that. And
I feel like women, something's off.
But you'll also notice more emotional fluctuations too, though, when their hormones are out of balance. So at some point, they're going to get a little bit more emotionally fragile and like, I need help. So that's what happened to this guy, man. Right. He did have to go on TRT though. He did. He went on TRT, but it fix it vanished. His anxiety, his depression, the whole thing just kind of went away. Unbelievable. And I know I've heard of that. I listen to a lot, like Lisa, I listen to some docs, some podcasts, and I pay attention to everything in that space, in the biohacking and anti-aging space. So it happens. It's for real. And guys, you got to take care of yourself. So, that was the philosophy. And I think we did a really, really good job. I think we came out with a great product. It's vegetable capsules. You have the testing, the certificate of analysis on the site. It's clean, it's healthy. They're natural ingredients, standardized. So many benefits. Let me see if there's anything that jumps out.
3 capsules daily with a glass of water. Food, no food, doesn't matter.
No, it can be with or without food. See how you feel on it. B3 does help the body. So the niacin also helps the body make sex and stress-related hormones, right? Okay. So the boron we talked about increases free testosterone. Horny goat weed for estrogen support. We've got the fenugreek. I talked about the saponins. Those are your extracts that are standardized. Helps increase your total T levels. The tribulus is sperm and fertility. So we talked about, that's another thing we didn't talk about, but like sperm counts are way, way, way down, man, over the generations. We're seeing so much declining in sperm production and fertility. And 50%, it really is about 50% of fertility cases. Most people think it's the woman.
I was just
It's
gonna
50%
say,
of the
it's so
cases
common.
are men. But so tribulus is good. Don't forget the shilajit with organic sea moss that I mentioned for that reason as well, for
Someone's
sperm.
asking here, they take the shilajit, is it okay to take it together?
Yeah,
Yes.
it totally is. It totally is.
benefits.
The Tongketali is just a Malaysian ginseng, but it's awesome for testosterone support. Again, standardized to the 2% uric hormone. It does have a benefit. Luteinizing hormone and follicle stimulating hormone can help with that. So it can help with increasing testosterone levels through different pathways. The saw palmetto, I did mention that for your prostate. For that is awesome, because what happens in the prostate is it converts from testosterone to dihydrotestosterone, DHT, and that DHT is what causes a lot of problems. So it does. The saw palmetto is awesome for minimizing some of that conversion too. So improving total and free testosterone while also helping with the prostate.
It's not palmetto. That's also good for prostate health.
I was saying that.
Oh, you just
I
said
literally
prostate
was
health. Sorry, I was reading.
Literally dialing in
Sorry.
to the prostate thing. That's
I'm
funny.
reading questions.
I think that, look,
Yeah, it was a lot.
yeah, it was a lot. So I'm happy to help you guys in any way. Please feel free to email me.
Couple questions here though.
Yeah.
So can women take? So Melanie, you're talking about
Testosterone therapy and the doctors don't know what they're doing. I've seen this a lot. And so this product would help a lot. The Vitality could help because it could help with your estrogen metabolism. It could help increase your free testosterone. It could help to do some of the things. The saw palmetto certainly can help the prostate. When you take exogenous testosterone, that's TRT. When you take an exogenous testosterone, your prostate, you need some support. I mean, you need to be watching your PSA. PSA is prostate specific antigen. You need to be watching and measuring your hemoglobin, hematocrit. There's all these different things you need to be doing. But this Vitality could help in the example that someone's on TRT and they're not doing everything under close supervision.
right. I find this interesting question. Oh,
one other thing.
Go.
Even if you're on TRT and under close supervision, some of these things work on different pathways in testosterone replacement therapy. Testosterone is just testosterone. Here's the body have testosterone. Some of these other herbs will prompt the body to do things in different ways, like FSH and LH. So I would say yes, Vitality absolutely can be safely taken with people on testosterone and my aminos. So, and I'm fasting. I don't have any food in my belly yet, so
I've had all that
And
plus E3 plus our protein and greens and collagen. I ate.
Nice. Yeah, nice.
Okay, awesome. I think that's about it. So if there's questions that were not answered, please go ahead and email me, lisa@livegood.com. If it's specifically for something for Dr. Ryan, it's best to email me because I can talk with him about it, because some of his emails go very, very, very long because he's got a lot on his plate. So make sure you email me. Make sure you subscribe to our channel if you haven't already. Like, follow us, join us every Monday at this time. Next Monday is our AUA, which is Ask Us Anything. So all product and health related questions, bring them to the table and we'll answer them live. And I know I just said you can email me these questions too, but I really like the community that we have going here when you ask questions, because it might be a question that somebody else hasn't thought about. So in turn, you're helping everybody, right? Again, this is a community. We're trying to teach, educate, and help others learn and understand. And check out our website for Vitality. If you guys haven't ordered it, men haven't ordered it, or women order it for your men, great stuff. Yes, have a fantastic week. Merry Christmas. Thank you. Happy holidays. Enjoy your time with your loved ones. And
All right, guys.